Absolutely. And I think it actually related to that, because I've heard other advisors and other admissions committee members mention this in relation to leadership. What's your view on working at say a summer camp or being involved in Division I athletics as an extracurricular activity? Most students, I find, don't think of that as part of the pre-med experience or a pre-med extracurricular necessary that's worthy of mentioning on their application.
Well, that's an interesting way to put it, because while those may not be pre-med activities, they're activities.
Absolutely.
Okay. And in terms of a summer camp, I don't know what that means anymore. You know, I mean, is it, you know, were you CIT? I mean, if you were probably 16. You're not, you know, maybe it's something you did in college. But in terms of Division I sports, or even Division II, whatever, and Division III for that matter, that requires a commitment on your part, and that's certainly something we look for, commitment. And that may limit some of the other activities you're able to do, but we understand that. Again, keep in mind what I said very earlier, holistic review.
Yes.
You know, it's not all cut and dry. That's why we have to look at everything. What's the arc in terms of their experiences, both academically and non-academically?
Absolutely. And I can say personally, as a former college athlete, that ate up a lot of time.
Yeah, it sure does. It sure does.
Clinical experiences.
Well, and that, and the fact, you know, we see applicants who've attended some of the military academies. They are not going to have the extensive clinical experiences that someone might have at a non-military academy, and yet they're able to get something in there, but they also have the leadership down in spades, you know, so in most cases. So it's pretty easy to look at someone and say, well, they don't have a whole lot, and then you say, well, but they're doing this 20 hours a week, and then they're going up to Walter Reed in the summers, and it balances out for us.